lunch breakout session after our Autism Disparities focus on March 13th, but then, COVID happened. And originally I had scheduled just sort of thinking about autism disparities in general. And, but once, oh, can you mute, please? Thanks. I started thinking about it and reading more about the inequities around COVID-19. I thought it would be really interesting to start thinking about, how this is affecting families, especially families that have limited resources, how COVID-19 is affecting their well-being and the well-being of their children. So I put together just a short PowerPoint slide. I'm going to go ahead and start that. And just want to emphasize that hoping that this could just be an open conversation. If you have questions, hand and say, and then the first time you raise your hand and introduce yourself, maybe you could just tell us who you are, where you're coming from. So I'm an associate professor of sociology at Georgia Tech, and I teach courses in sociology of medicine and health inequalities, race, medicine, and science, sociology of science and technology. And my research over the last 4 years has focused on autism disparities to services here in Atlanta, Georgia. So I've been doing an ethnography interview survey with caregivers who seek services at the Autism Clinic downtown. And I'll show you a little bit of that data today. And so unless you're speaking, turn the microphone off because there could be a lot of background. And, just raise your hand if you want to talk. I want it to be sort of like we are at a table, just sort of eating our crackers or apples or our lunch and just having a conversation. I don't think if you want to ask a question, I think there's a few of us enough where we could just have it, live. We don't have to use the chat box, but it is there if you want to. Just know that this discussion is being recorded. So if there's anything that you don't want to share, don't identify yourself or the like. But again, this is an open discussion really based on question. I have prompts and, questions that you might have. So I've been following stories of issues that people with autism and developmental disabilities and their caregivers, families, teachers, and providers are experiencing as a result of COVID-19. I'm sure you have as well, which has resulted in sheltering in place orders, a switch to online learning at home, closure of community and public resources, and for many, the loss of employment. This is a really major concern. So these headlines taken from recent stories, I have a Google alert that tells me when there's been a news story that's been taken place, whether it's be around developmental disabilities, autism, or disabilities more generally, and COVID-19. And what these stories highlight are the struggles and concerns that are real issues for people with disabilities and their families. They range from the stressful challenges of disrupting routines and changing actual establishing new rules, the impacts of the loss of social and emotional connectedness that a lot of people have through school and work, the difficulties of accessing needed treatment, medication, and other support services, and for caregivers, the pressures of balancing work, balancing being the primary educator in the home, implementing therapies, and really trying to develop a routine that will benefit their child or help them thrive in this time. And there's also been stories about the underreporting and potentially large number of deaths of individuals with disabilities who are living in nursing homes. We've heard about the elderly folks, but we have to really start thinking about other people who are in group homes or, other kinds of environments where there's large numbers of people. Special education teachers are also reporting the challenges they're facing. I mean, Dr. Pearson and I were just saying, just as educators, it was really hard to sort of grapple our heads around how do we switch to online. And so for special education, this could be particularly challenging because there's a lot that goes into, the physical nature of the education itself, whether it be speech therapy, occupational therapy, and the like, which some people are saying is near impossible in terms of educating. And then, this doesn't mention the technical challenges, right, that might occur if folks are getting online services, or just the sensory overload. I mean, I have sensory overload just being on the internet, interacting with people in this way. It's very different, and it actually takes more work because I can't see Brianne's face, right? I don't know, maybe she's not engaged, or maybe she's really excited, so, and even other kinds of physical signals that we share with one another. So these stories really highlight serious consequences of COVID-19, right, with people with autism and their family. And there's a lot of consequences. There could be increased self-injury or aggression, the risk of abuse if sheltering in place with a domestic partner. I don't think this is really talked about very much. Developmental regression might happen because they're not getting their IEPs are out the door, their therapies might be stopped or on hold or just not effective. And then there's the social and the emotional isolation that could be occurring for not only the people who are experiencing developmental disabilities and autism, but the families and the caregivers themselves. And then I think, again, the big one is the economic strain, especially for those with limited resources before the pandemic. And this, of course, creates a cascade of so many other issues. So I don't know if many of you are aware, but Spark conducted kind of an immediate survey of families and children with autism and how COVID-19 has impacted them. Now, Spark, for those of you who don't know, is like a national autism research project that has, 13 different sites where they collect data from families, genetic data, biological data, and other kinds of data that they're trying to use to make meaningful information. So they tapped into the people who've already participated and sent out a survey. And this just gives you some of the, the characteristics of who responded. They found that 63% of families reported severe disruptions in services and therapies. So over half, right, are feeling disruptions in what they were already getting. And of that, 64% of families reported that speech therapy was the most disrupted. And so these are certainly areas to think about and how this could be improved, right? The settings that are most disrupted are highest for school settings, which isn't surprising. I think 98% of the folks who responded said that school was canceled or that online courses were part of the new normal as a result of the pandemic. And just over half reported that their professional clinic was disrupted. And so in Atlanta, I know the autism clinic has not been open since March, which is really concerning because when I observed there could be up to 20 families that come in that one day. It's open 3 days a month. And so that's 60 families times 3 months. That's a lot of people who are not getting services. So I'd be curious to hear from folks here what services have been disrupted from your perspective, and to what extent. So that's sort of an open-ended question, if we want to talk about that. What sort of services have been disrupted in your experience as it relates to, families and children with autism? Anyone want to share?
Well, we at the Department of Behavioral Health, we have, of course, have a lot of staff who have not been able to shelter in place because they do serve young people. We've been working on building a crisis continuum for young people on the spectrum. And we work very closely with some of the psychiatric residential treatment facilities in the state that serve, and actually there's really just one of the PRTFs that serve children on the spectrum, and that's Laurel Heights on Briarcliff Road. And so we've been working hand in hand with that organization, the medical director and the CEO, and they've been working every day. And in fact, I just spoke to the CEO on yesterday morning, and he said,